there are going to be some hurdles for sure. If you look at the launch of biosimilars both in Europe and in the United States, uptake into the market is slow. I think that comes because there's some physician barriers, which I think are largely educational barriers. Then there can be sort of reimbursement barriers, if you will, where payers settle on their formulary in favor of the originator or the biosimilar. And then finally, I think the biggest overriding barrier is just education of all the stakeholders, including the patients, who at the end of the day are going to receive the drug. Education is key, and in the case of interchangeability, it's important to remember that is a term that's unique to the United States regulatory environment. And interchangeability permits substitution at the pharmacy level without having to notify the provider. And I think that one's going to be very, very difficult because as providers we want to be in absolute control of everything, and I think most would be uncomfortable with a pharmacy level substitution and not notifying the provider. And each state is taking that issue up independently and has come up with a variety of issues, because you have to remember at this level it will be a state decision and not a federal decision.